Today we're going to talk about a broken bracket that is sliding on your wire, mostly a back bracket. When you have a back bracket that is broken, typically it's going to be locked in by two other brackets and it will be sliding back and forth on the wire. Sometimes it can just be this single bracket. In that case, it would slide off the back. When it's sliding back and forth on the wire like this is not considered a orthodontic emergency. It is a little uncomfortable sometimes because the bracket can twist and it can feel kind of weird in the mouth. It also can just be really annoying. However, it won't come off of the wire because it's locked in here by two additional brackets. People oftentimes are concerned that their kiddo is going to swallow it or it's going to be in their food. And most of the time, it's just locked in here. Okay, so when this happens, what can you do at home to fix this? There's a couple of different options. The easiest would probably be to use some wax. You'll want to make sure that you have a big sized ball of wax and you make it kind of squishy with your fingers. You'll want to dry the area off and you can squish it onto that bracket. Then it will prevent it from moving around until you're able to get into CS. The next option that you can do at home if this happens is you can use fingernail clippers or cuticle cutters. What you're going to want to do is get your cuticle cutters, in this case, as close to the next bracket that is not broken as you can, and you'll clip. If you're not comfortable doing this, the wax is going to be your best option. One other thing that you may notice happen is when you get really close to that next bracket, if you clip, you may pop the bracket off in front. However, it is okay as long as the patient is not in any discomfort.